Good morning or good afternoon, depending on where in the country you are. This is Megan Renner from the United States Breastfeeding Committee, and we'd like to welcome you to today's bi-monthly Breastfeeding Coalition's teleconference, which is now also presented in webinar format. We have everyone in listen-only mode today as usual, and I want to just give you a little bit of logistical background before we get started. We do have everyone in listen-only mode, as I said. There is a button on your webinar screen that will allow you to type questions to us, and that if your webinar screen is currently collapsed, which usually it does after you log in, you'll notice that there is an orange arrow on your control panel, and if you click that arrow, it will pop back out for you. And then down closer to the bottom, you should see a little plus sign next to the word questions. If that is currently showing as a plus, go ahead and click it, and it will open up. And then that is where you can type questions for us. And please feel free to type those at any point during the webinar. And so again, my name is Megan Renner from the United States Breastfeeding Committee. And today I also have two co-presenters with me. Jennifer Matranga is the current Coalition's regional representative from the Southeast, and she is also from the Connecticut Breastfeeding Coalition. And then we also have Linda Jackson, who is the current Coalition's representative from the Southwest. I apologize. Jennifer is Northeast, and Linda is Southwest. They are the polar opposites of geographical regions. Linda is from the Southwest, as I said, and she is with the Texas Breastfeeding Coalition. So I'm going to go ahead and show you our slides here. And our topic today is the building blocks of the SGCTA, which is our lovely acronym for the Surgeon General's Call to Action. For the SGCTA infrastructure, the role of coalition's regions. So we will especially be focusing today on the coalition's regional representation structure that we have set up just in the past few years with USBC. So I will start us off and talk a little bit about the history of the regional structure, as well as how it has evolved over time, formalized a bit more, and some of the background of how the nominations and elections procedure works for the regional representatives. And then we'll also hear from Jennifer and Linda a little bit more in depth about how they have used the structure within their regions, because this is something that can vary quite a bit from region to region, how the state coalitions are taking advantage of this and using it as a networking tool within your area. So without further ado, let me move on to our next slide here. Oops, and a little flip. Okay. So we started off the regional representation structure with USBC's 2009 strategic planning. At the time, we were really getting ready to do our first strategic plan as an organization and wanted to make sure that we had representation from the voices of the coalitions. At that meeting, we also invited a number of other stakeholders who may not have been member organizations at the time, and we're really looking for that diverse representation in the room. But we also knew, of course, we only have 45, in the mid-40s number of member organizations nationally. So if we had brought in all 50 states, it would have been quite overwhelming to the size of our typical group. So we came up with this idea to start representation structure for this ad hoc purpose at first, and we organized it according to 7 geographic regions. These are based off of the WIC regions, if you did not know that. And then we also have an 8th region for tribal breastfeeding coalitions. We asked the coalitions to elect representatives for each of those regions, and at this time there was just one individual for each region, and they were elected according to 1 vote per coalition. I have given you a link here where you can view the chart of the geographical regions. So do feel free to click that if you're not familiar with them. It will show you which region your state falls into according to the structure. So And then at this stage, we did not have any travel funding. You may remember this was back in 2009, and you may remember that we did have some interesting discussions about how we would fund the reps to get to this very first meeting. But at this point, it was just a pilot, and there was no travel funding. And then this here is just a list of the inaugural class of Coalition's regional representatives. And you will notice that a few of these have continued on and are still the reps today, and then a few have been replaced by subsequent elections, and we did do that on purpose. You'll see a little bit of why in just a second. So then after the very first strategic planning meeting, we went through a bit of a transition period with the regional representative structure. We really realized after that meeting how valuable it was, how wonderful it was to have the coalition's voices represented in the room at USBC. And the original group, that inaugural class of reps, also came to the August 2009 and January 2010 USBC meetings. And this was during this period we were really going through finalizing the strategic plan, finalizing the objectives underneath the 4 major goals, as well as the implementation plan for that. And so the regional reps continued to liaise back and forth as we did this deeper level of planning. We also, during this time, started up the regional listservs, which if you are not currently subscribed to, you can click this link here to get to that web page and join, and we do welcome you to do that. We had a system set up for teleconferences with the regions, and this continues up to this day, where we are having the regional teleconferences that happen right after these bi-monthly national webinars. And then at the January 2010 conference, the Coalition's conference most recently held, we did have regional meetings for the very first time, and these happened on the opening night of the conference. And you may, if you attended, you may recall we also had ribbons at the conference that identified which region you were from, and really tried to start up this as a networking tool at the conference in person as well. And I think that the feedback that we got as we're considering planning for 2012 is that having that regional meeting on the first night was a good thing, because then it allowed folks to get to know people at the beginning of the conference and see the faces, and then to continue that networking throughout the conference. So we will, of course, love to hear your feedback on that, and you'll see that that's one of our discussion questions for today. So please let us know, again, about what you think for that. So then, again, continue to formalize the process. Those inaugural reps worked with our coalitions committee to formalize the process for nominations and elections. That continues today. The elections are held every spring. At this point, we also formally added an alternate. So originally, as I said, there were only 8 reps, 1 for each region. Now we have 16, both a coalitions regional rep, a CRR, and an alternate regional rep, or an ARR. We also set up a 3-year term, and we set this to stagger. So this is why, as I say, some of the original reps are still on today, and then we have some new ones, and we have done that intentionally to make sure that we didn't lose all of the experience at one time. We want to stagger that out so that we have no more than 3 regions with new reps in any given year. So that's part of the policy and the procedure. This is just a quick glance at the election schedule. So the first year of formal elections was 2011, and we had Northeast and Southeast last year. In this year, in 2012, we have just this morning opened up the nominations process for the 3 M's, Mid-Atlantic, Midwest, and Mountain Plains. You all are elected this year. And then next year will be West, Southwest, and Tribal for elections next spring. Also have here a link to the roster of the current reps, so you can see, if you are not familiar with who your rep is, those are the folks who are currently reps. It also shows their terms according to this election schedule. And so, as I said, it's a 3-year term. So the ones elected in 2011, the next election will be 2014. Ones elected in 2012 will be 2015. So just add the +3 to know when the next election will be for your region. Again, the process is still that every coalition has 1 vote, and so that's the state territory coalitions, and then in the tribal region, each tribal coalition. We do require participation of a majority of the region's coalitions for a quorum. So that can vary because the sizes of the regions do vary quite a bit. I believe our smallest is Southwest with 5 states. And so a quorum in Southwest would be a majority of 5. That would be 3. We have others that are 12, even more coalitions in that region. And so there, for example, in a region with 12 states, there would be, the quorum would be 7. So it can vary quite a bit. The voting instructions are sent to the 3 designated contributors for each of the coalitions in the region. And then those 3 are asked to talk amongst themselves and make sure that they assign just one of them to submit the coalition's vote. So that's a little internal process that might happen differently depending on your coalition's particular governing procedures, but we do leave that up to you to decide how you will place that vote. And then because we have the regional, the CRR and the ARR, the highest number of votes that is given to an individual up for election, that person would become the CRR. The second highest number of votes would become the alternate, the ARR. Just flip here. So eligibility, and this is one area that has evolved a little bit over time. We do ask that folks who put themselves up for nomination, and it is all self-nominated, that if you are nominating yourself, that you are an active member of your state, territorial, or tribal coalition, recognizing that some coalitions don't have formal members. We know that the varying degrees of member classifications, that can vary across states. If you don't have formal members, then we would ask that the nominee be an active leader or a participant in the coalition. So we want to make sure that that person is tied to the state coalition. You will sign off and agree to take on the roles and responsibilities, which I'll talk about in just a second. And then we do require a letter of support from your coalition. And that would be from the state, territorial, or tribal coalition. So that is a requirement, and that can be submitted by fax or email. Doesn't have to be long, but just, again, to make sure that you have that authorization from your coalition, that they recognize that you are a member or a participant in that coalition. So they're sort of vouching for you. And so here's a little bit about the roles. This first section is actually mirroring some language that we have for the USBC Board of Directors, and it says that CRR and ARRs, the positions are held by an individual, and so they're not reflective of your individual state coalition. So when Linda is serving as the Southwest regional representative, she's not serving as Texas Breastfeeding Coalition. She's serving as Linda Jackson, the individual. And so then the corollary to that is that the duties of the regional reps are to serve and carry out the best interests of the region as a whole. You are not thinking only of your, oops, lost my slide here, I apologize. You are representing the whole region, not just Texas or not just Connecticut. And so, as I said, that's language that we do mirror with the USBC Board of Directors, that when an individual is serving on the USBC Board of Directors, they are serving as Jane Doe, the individual, not as, for example, the American Academy of Pediatrics. Or they're representing the best interests of USBC as a whole and not of their particular member organization. So just a similar structure. Specifically, the responsibilities, of course, the regional reps are serving as liaisons. They're fostering communication back and forth between the national and the regions, the state coalitions within that region. They do attend our biannual USBC meetings, which are held in January and August every year. They serve on our coalitions committee, which is the advisory group, the oversight group that oversees all of our different coalitions activities, including the coalitions conference, technical assistance that we provide, these webinars and teleconferences, all of the range of things that we do. They also assist us in identifying, assessing, and prioritizing coalition needs, and this is something that we do quite regularly. We have regular phone calls where we discuss these types of issues. And then communicating concerns or issues. If there may be a particular concern or snafu of some kind happening within your region or within a particular state coalition, the regional reps will, in those instances, will come in and we will work together and communicate back and forth to try to resolve those concerns or issues. That is a little bit more of a rare occurrence, but it does happen, and it is a great resource to have that regional rep as an additional resource for that coalition. And then supporting and promoting USBC events, and so that, of course, means things like the conference and these webinars and teleconferences. In addition, the regional reps facilitate networking and sharing between coalitions as well as between regions. And so they do this in a quite robust manner. At the USBC meetings, they are always having dinners and other additional meetings where they're having great discussions and thinking and planning and plotting on behalf of all of the coalitions in ways that we can do this more and do it in a better fashion than we have in the past. So we have some discussion questions for you at the end that will help to guide these ongoing discussions. And so they might be educating coalitions on the tools and resources that we have at the national level as well as via the regional listservs. And they serve as the moderators of the regional teleconferences that again, happen right after these calls every other month. The ARRs, the alternate regional reps, they are similar in function to a vice president, that if the CRR is unable to attend a particular USBC meeting or conference call, or is otherwise unavailable, the alternate regional rep will step in and perform all of the duties that we have listed above. They also serve on the USBC Coalitions Committee, attend the bi-monthly teleconferences, and generally are involved in all of the things that we discussed with the regional rep. But they have that alternate function so that if the CRR is unable to perform their duties, the alternate is able to step in. And travel funding is another piece that evolved after that first meeting. We did secure funding through our ongoing coalition support with CDC that allows us to cover the airfare and 2 nights of lodging for the CRRs to attend each of our meetings. And again, those are January and August, twice a year. If the ARR attends in place of the CRR, the funding would transfer to the alternate. But at this point, that funding is only covering 1 person from each region. So then the corollary to that is that if the regional rep does attend in addition to the CRR, if both are attending the same meeting, there is funding support only for one of them. And sometimes they might negotiate between the two. You know, my work is covering it, so why don't you use it this time? And that is also flexible. We do have the ability to flex between that if there are different ways that can work depending on the region's situation. So the other exciting piece, and again, part of why we wanted to discuss this, this topic on this call, is that just this past month, USBC has passed a bylaws amendment that creates a new membership category for the coalition's regions. And so here I have quoted for you the actual definition for that coalition's region member. And that is states that the 8 regions, and it goes on to define the regions according to that chart. The 8 regions of state, territory, tribal breastfeeding coalitions are automatically voting members in the USBC, and that you will elect individual reps pursuant to the requirements and nominations in our policies and procedures. And so that is then referring back to the nominations and elections procedures that we have had for a couple of years now. So this is a big point of celebration, yay. We're very excited about this. As I have been mentioning, we have, over the last 3 years, been formalizing this more and more and more. And so this is the culmination of that. And we did have to seek legal review on this language because it is a little bit different from our other member categories in that the member is the coalition's region, and the coalition's region doesn't have to apply. So in all other instances with USBC members, whether it's a national nonprofit member or a governmental agency or an advisory member, all those other types, they have an application form that they fill out. As it says here, the coalition's regions are automatically voting members, so there's no application process that happens. So that was a little bit of a just making sure that we worded that correctly, and then we now have passed that as of actually Leap Day. February 29th was the day that it formally passed. And so we are in the midst of now incorporating some of these changes have to then be made into our membership policies and other areas of our governing documents, but this is just a little summary of the additional member duties that would apply in this situation. So again, it's important to realize that the member is the coalition's region, so Southwest, Northeast, West, Tribal, and then the coalition's region elects 2 representatives to participate with USBC. And so that mirrors the same structure as our other members, the national nonprofit organizations, the federal agencies. They also designate 2 individuals, a representative and an alternate, to attend USBC meetings, participate in committees and task forces, and all of the different things that our member representatives do. So very much the same structure, but it is a little bit different because, again, the regions don't have to apply. You are automatically, the 8 regions are members. So this little summary of some additional areas where now that the coalition's regions are a formal member category, they are asked to support the purposes of USBC, abide by our bylaws and policies, and that seems to be a no-brainer, of course. One that I have been specifically asked about a couple of times recently is this second bullet here, that an individual may represent and cast votes on behalf of only one member at a USBC meeting. So what does this mean? This would mean that if, let's say, the same individual happened to be a regional rep and then also to become, to be appointed by one of our other member organizations. If that were, that's not the case right now, but if that were to happen, this particular responsibility or duty would apply, that that person cannot sit at the table and represent both entities at the same time. So they would have to, for instance, pass their voting paddle over to their alternate at that meeting. So that's something, it's not prohibited by our policies that the same person couldn't do both, but it is, I would say, mildly discouraged by this piece, because it would get tricky. You would have to make sure, if you were representing both, you would have to make sure that there was another person, your alternate was attending the meeting to separate that voting power. So that's one I have been asked about recently. All of our members do submit written reports of their activities to USBC. Again, all member representatives are asked to avoid conflicts of interest, and we do have a conflict of interest policy. And then again, this is something that most of the regional reps were already participating in USBC task forces and also the coalitions committee, as I said. But this is also a piece of being a member representative, that you're expected to participate on committees and task forces. So I have provided here a couple of quick links. So related to coalitions, since we are coming up into the elections process, we'll be opening up in just 3 weeks, where we will be asking the coalitions in the M regions, again, Midwest, Mountain Plains, and Mid-Atlantic. You are up for election this year, so please do make sure that your designated contributors are up to date, and I've given you the link here for where to go and do that, because those 3 folks are the ones that will get the link for the voting. And again, that'll be just about 3 weeks for when the voting will open. And then also I've noted here about the coalitions directory, that registered coalitions are listed in the directory, and if you have not checked that out in the recent past, I do encourage you to do that. Just make sure that we have your name, your website, everything correct. I know sometimes coalitions are changing their names from task force to coalition or vice versa. There's been a lot of name changes in the last few years, and we want to make sure that we have you listed correctly. And then separately for individuals, the nominations, as I said, just opened today for those 3 M regions, and this link will take you to the page for additional information about that and how you can nominate yourself. It's just a quick form to fill out, a little bit of a bio, as well as your involvement with your coalition. So please consider nominating yourself, and we will look forward to seeing those names. So I'm going to turn it over now to Jen Matranga. Again, Jen is our current Northeast Coalitions Regional Rep from Connecticut, and she's going to talk to you a little bit about how the Northeast has used the regional rep structure.
Okay, hello, this is Jennifer. I'm excited to talk to you today specifically about the Northeast region. And on my first slide, and as Megan reviewed, from strategic planning to proud to represent Northeast Regional as the new member. And my next slide, I begin with where I began at that invitation to the regions to vote for representation for that strategic plan. And it really made sense, this idea for the regional reps. It would be impossible to have all states represented, but the regional role was a great idea so that the states could have representation. So that initial role of the regional representative pre-strategic plan was to offer conference calls for my region, the Northeast. There were questions sent by email, so everyone was prepared, and on 2 to 3 separate conference calls, we gathered the answers to specific questions that I was then responsible to bring my region's voice to the United States Breastfeeding Committee strategic planning session. So then attendance at that USBC meeting in Washington to represent my region and offer all of the feedback that came from those conference calls. And then my role then, from then on, has always been then to bring back to my region the news from USBC meetings. And on my next slide, I did add then from that strategic goals, and the link is at the bottom of the slide. Goal A, what came from that strategic planning. Goal A, ensure the quality breastfeeding services are an essential component of health care for all families. Goal B, reduce marketing that undermines optimal breastfeeding. Goal C, ensure that women and their families in the workforce are supported in optimal breastfeeding. Goal D, ensure that USBC is a sustainable and effective organization, funded, structured, and aligned to do its work. And again, if you go to the link, the explanations and more info on each of the goals is there. And on the next slide, what I wanted to share is in the Northeast, from the questions that we reviewed to prepare for the strategic planning, we felt that we had a great start to gather together in a summit. So I'll start right there to say, of course, in New England and the Northeast, we have a great geographical advantage compared to some of the other regions. We're probably one of the only regions where it is actually doable to be able to drive to a central location and meet. So we took a look at all of our answers on those pre-calls. When we answered the questions, we utilized those responses, looked at what we answered were hot topics, what areas we needed and would like to have more discussion, where education could be offered. And then we also found out who were the experts in our region. So on the next slide, it's a little bit of a copy of the agenda that we used for our first Northeast Breastfeeding Coalition Summit. We tried to get little Northeast logos to be cute there. And the theme was simplify. Again, we took from those top 10 hot topics, insurance coverage and licensure. We spent a good bit of the morning on because those were the topics that the most people were interested in. And baby-friendly and empty were also of high interest, so we spent the afternoon on those topics. There were many other topics, hot topics that we had table tents, and we broke out for a good bit of time during lunch for networking, and you were able to sit with different people to talk about those specific topics. So this was funded by 3 of our coalitions, just with $50 to $150 just to pay for lunch. We had a free room offered to us by a local hospital. And at the end of that day, we did a wrap-up. We did do evaluations. And on the next slide, I'll be able to show you that there actually were 25 in attendance on that day. We did have representation from all of our states in the region. And in case you're curious, the hot topics discussed at lunch were consumers driving agenda, the business case for breastfeeding, waivers, World Health Organization code, milk banking, state coordinators, and social media marketing. We also at that point were offering to each other excellent documents and tools. So we had asked Megan if we could create a toolbox on the USBC website. And we've continued to use that as we do our monthly regional calls after the conferences, calls, the teleconferences, that if a state is offering an excellent tool, we ask them to put it in the toolbox for everyone to have access to. So again, we looked at our evaluations, discussed the location, and on the next slide, we realized that gathering as a summit, it was just so great to be able to put faces to the voices on conference calls and emails. So we were excited again in January 2010 when we were able to gather for that coalitions conference in Washington. And as Megan said, that we were able that first night to get together as a region. So again, we look forward to doing the same this coming August, to gather as a region, to network, mentor, and encourage one another. And a possible plan for October 2013 to try to do another summit. So I really want to encourage all of you, if you're thinking of putting your name in those regions where the vote emails just went out, I encourage you. The idea to split where just a few regions go out for a vote at any given year is great, because those of us who have been doing it for a couple of years will be glad to mentor you. So I just really want to encourage you for those regions. And on the next slide, Northeast representation, ongoing roles and responsibilities. So I'll continue to facilitate the regional conference call following the CDC-USBC teleconference. Assist with encouraging states that can mentor each other, helping them get together. Bring to the United States Breastfeeding Committee meetings the concerns of my region, the voice, and bring back to my region information from the USBC meetings. Some future goals to network with other regions to bring expertise in specific areas together, to continue to moderate the Northeast listserv. And it's been an honor to serve, and I thank you. That is my presentation.
Wonderful. Thank you so much, Jennifer. And so next we will hear from Linda Jackson, again in the Southwest region. We did want to try to have a couple of different regions for you today. And so, as I said, we have Northeast and Southwest, so the polar opposites of the geographic directions. We did have a little snafu. Linda's having some computer trouble today, so was not able to submit slides to us, but she will be speaking about the Southwest region. Linda?
Thank you, Megan. And again, I'm sorry for my computer issues. I'm traveling and had to do this presentation from my hotel room. So I am Linda Jackson, and I am the Southwest Regional Rep for the USBC. And as Jennifer said, it's been an honor to serve. I was lucky enough to be the inaugural rep for my area and have remained in this role and look forward to another year of serving. And I just wanted, Jennifer did such a great job covering our roles and our responsibilities, and we all mirror those same roles and responsibilities in our area. I just wanted to give a few little things that we've done in the Southwest region and to kind of talk it in a formal and an informal way. We have not been able to hold a summit like Jennifer did in the Northeast region. We're a little geographically challenged. I know Megan said we're the smallest with 5 states, but I would say that Texas should at least count for 3 or 4 northeastern states in our size. But we do get on the calls every month. We have some very passionate people in our region, as all of you do, and it's been great to network and kind of compare ideas from our regions. And it's been nice because we find that we have similar or parallel things going on in the different states. For example, Louisiana has their GIFT program for recognizing organizations and hospitals that are doing a lot to promote breastfeeding, and Texas has our Texas 10-step. So we've kind of shared some ideas and some thoughts. We have discussed several times the hope that we might do something along the lines of a sort of a mini regional conference or a summit, even talking about the idea that we might do it on the off years from the coalition's conferences that USBC sponsors every other year. But one of our other challenges, of course, is funding, because all of us are volunteers in what we do. Several people have, occasional funding from their organization, but in our region, the states all have some type of coalition forming, but some are more organized than others. We have some that are just sort of informal meetings where they all get together, and we range all the way to very formal, well-established coalitions that have bylaws and have applied for 501c3 and are working on all kinds of branching out efforts. We have found that maybe the most successful part of our networking and communications has been the bi-monthly calls, our regional calls, and we've gotten to know each other fairly well on those calls just from our sharing time. But we do look forward to getting together, as Jennifer had said earlier, about getting together in person and putting those names and faces together. We really look forward to the more sort of formal role that we'll play in USBC. And on our call today, in fact, we're going to talk about all of this and how we might better communicate to those areas of our region that maybe we can't reach out to as easily. We're trying to actively seek out some of the what we call the local coalitions in each state that make up the state coalition. So we will be looking to learn from other regions at this next conference in August. And again, I apologize for not having something for you to look at and something to share online, but as Megan said, my computer crashed. So without having that in front of me, I think I will stop there and try to get something maybe to Megan later that she might be able to add to the slides. Thank you.
Wonderful. Thank you, Linda. So I do have a couple of additional slides here that are part of our announcements, and then I will get back to the regional topic just a little bit at the end, because I do want to set the stage a little bit. We have suggested some discussion questions, as we usually do for the regional calls, but we are especially interested in hearing your feedback today. As I said, this has been a topic of a lot of discussion at our most recent meetings about how we can most effectively network amongst the coalition. So first I'll just talk very briefly about the conference, because I know this slide with the basics, you probably have heard this several times from me already, but just to make sure everyone knows the dates and the location. And then again, the schedule is very similar to the past, the opening on Saturday evening, ending by midday on Monday with, of course, the Advocacy Day is an optional event in the afternoon. On this second slide, I wanted to just highlight some of the major dates coming up. One, of course, is the breakfast table topic and poster submission deadline, which is next week, Friday the 13th. And I do want to really encourage folks, we say this every year, but we really do need to have many breakfast table topics, and we really want to encourage as many coalitions. Even if you think that your project is not ready for prime time, even if you just want to have an informal discussion with a few other folks at your breakfast table interested in the same topic, all of those types of situations are perfectly okay for a breakfast table. This is an informal topic discussion that happens amongst the 8 or 10 people sitting at one breakfast table. And so in order to have 300 to 400 people in the room, that's a lot of breakfast tables. So please do consider submitting that. Again, it doesn't have to be a completed project. It can be something in progress, something that you're thinking about. It could be a lesson learned, or again, it could also be just an informal, we'd really like to talk about breastfeeding and family law. That's one that I would love to talk about. So please consider that. Again, the deadline is Friday the 13th, and then also on poster presentations is the same deadline, Friday the 13th. We are very busily looking at the submissions that were put in for breakout sessions. This was an earlier deadline, as you know, and we are on track to meet the deadline of notifying all of those who submitted breakout sessions proposals by Monday the 16th. So do watch for that. Please do be patient with us and give us a little bit more time. I have said here that we will publish the full schedule by April 30th, and that is just to give us a little bit more time to tweak and fill in any gaps. If we put together a couple of proposals and say we want to do a panel, but we want to invite somebody else to fill in some gaps, that's why we have a little bit of a delay there. So breakout submitters, you'll be notified by the 16th, and then we will be publishing the full schedule by the 30th. And again, that will be up on the conference website. And then subsequent to that, registration will open in May. I have given you the basic link for the conference here, and you will find on this page that we have put up down at the bottom under the registration information section, there is now a link that will take you to the FAQs, which will include the registration fees. The budget has been approved, and so all of those fees are there. And we will be adding still more information and FAQs to that section over the next couple of days. There are always many questions that come up, and so we welcome your questions, because then that helps us to know what other FAQs to add to that section of the website. So do check that out. I believe I do have just a couple of minutes that I can talk about this, because I know that the announcement last week of the Kellogg Foundation grant to USBC has been of great interest. I've been getting many emails, and we are very excited about it, and are very happy that to have heard from many folks who are excited as well. Knowing that there's only so much information that we could put in that press release, I thought it could be helpful to just give a little bit more detail today in just a couple of minutes during our announcements here to explain a little bit more about what this grant is going to do. And as we said in the press release, Part 1 is focused on our support for the State Breastfeeding Coalition, and this will be including a comprehensive assessment of what activities are going on in the states, as well as different stages. What stage of coalition building might you be in your states? So you will be hearing from us over the summer on this, and we will, as I think I might have mentioned in the past, we do intend to actually schedule a phone meeting with each set of coalition designated contributors. So again, all the more reason, please make sure that your designated contributors are up to date as the 3 coalition leaders that you would like to be our key contacts for this, because we will be working to schedule meetings with you in person. So as you know, in the past we had done a little bit of this type of assessment by written survey, and we will probably have a component of that as well, but also really want to have this time where we can sit down and talk with each state coalition, as well as territorial and tribal coalitions, and get a little bit more in depth into what's going on with you. So we're very much looking forward to that, and then we will be using that deeper assessment to inform more customized technical assistance, training opportunities, networking opportunities in the future. So I want to make sure folks realize for this part of the grant, what it is funding, especially for year one, is the assessment process and building up our capacity at the national level to support all of you. So what that means is that there's not sub-granting money in it right now, not ruling that out that it may not be a possibility in future years for there to be a source of funding. And believe me, we are always advocating for this. But at the moment, the grant is funding building up the national infrastructure to support the coalition. And then similarly with Part 2, and this is the part that is applying the collective impact model, specifically focused on, I believe this is Action 8 of the Surgeon General's Call to Action, the access and continuity of skilled support, especially in year one, and I think on my second slide it notes this, we will be starting out building the national infrastructure. We'll be engaging with a consultant that specializes in collective impact, expanding our staff capacity here at USBC, and also recruiting national partners to join us in this process. So just a little bit more about what that funding is allocated towards. And so we have been hearing from many states and communities, even since that press release went out, about the great things that you all are doing. We're very excited to hear that. We are filing and creating a database of all of those different contacts that are reaching out to us. We're not quite at the point yet where we're going to be able to act on those, but we will, as I said, we're creating lists of all the folks contacting us with possible success stories to share from your states and communities, as well as possible collaborations with that collective impact process for the future. So please bear with us. As I said, we're building up that infrastructure over the next few months and engaging with that consultant. And then we will have the resources in place to really be able to respond to that. So, but again, please feel free to keep the ideas coming. We're very excited to see it all. And as I noted, we don't have funds to grant out right now. I think there were some folks that thought that that was the situation, but at this point it is not. If and when it happens in the future that we have a sub-granting opportunity for the coalitions, you will be the first to know. And again, we're always advocating for this. And number one thing that I advocate for, right, for all of the coalitions is to have some additional funds, because we know everyone is struggling, especially in the wonderful economy that we hope is now improving. So just again wanted to thank you for everything that you're doing before we get to the question and answers. And I have just included here just a little reminder of where you fit in, as well as USBC, into Action 20. This is something that we hope that you are all taking advantage of, this wonderful call out in the call to action to USBC and the state coalitions when you're conducting your advocacy in your states. That this is a wonderful resource for us, and every time we can mention the Surgeon General, it's really helpful to all of our great work. So I'm just going to pop out the question box here. I did see a couple of questions. I fear I have misled you about links again. It may be that the links, if you're trying to click the link straight from your webinar screen, it may not go anywhere. But if you do download the PDF, the PDFs are active this time. I will actually go over here and show you on the website. If you go to our home page, the place to find the archives of all of these teleconferences, on our home page under the quick links box, if you click on bi-monthly coalitions teleconferences, and then you click on this teleconference slides for today, this lovely PDF document will have clickable links. So here's the chart of the regions, and we can show you all the different states and which regions that you fall into. So do go to the website and click on that PDF, and then the links will work for you. Sorry about that. And then I also meant to mention last month with our advocacy presentation, we had slides with a number of links in them. We have reloaded that file to the archive, so that one also has all of those links are clickable as well. So if you go on the 2012 archives of past teleconferences and click on the State of the USBC collaboration slides, that one will now have everything in there is now a clickable link. So So again, apologies for misleading you about links. They don't work straight out of the webinar, but they do work in the PDF. All right, so let me see. We had a question about the Kellogg grant, which I then talked about. Let's see. We have a question about the toolbox that Jennifer referred to. And the question is, do all regions have access to the toolbox on the USBC website? And the answer to that is a yes and a no. At the moment, you don't, because that is something that we piloted first with the Northeast Coalition, wanted to find out if it would be useful and something that would work for them. But now that we have tried that out and we know that they are using it, then we will make that available to all of the regions. So if that's something of interest to your region, please do let us know. Probably the quickest way to do that, the regional reps, if you talk about that on your calls this afternoon and you'd like to set that up, just shoot me a quick email, and it's quite easy to do. Here's a question from someone who is a new member in the Mid-Atlantic region. Very passionate about breastfeeding promotion. What general advice can we offer in terms of serving in some capacity either at the state or the regional level? And I guess I'll start that one off, and then maybe Jen and Linda, if you have some suggestions to add. It doesn't tell me which state this person is in, but I do know every state of course has a little bit of a different situation, as do the regions. So I would first encourage you to get in touch with your state coalition. They may have opportunities for volunteering or becoming a member, depending on their membership structure. You also may want to look into local breastfeeding coalitions, because there are often local community or county coalitions that might be closer to you, depending on how large your state is. So I do encourage you to look into both of those. One place to go first, if you're new to the coalitions and trying to find who's closest to you, I would recommend going under the Coalitions tab of our website to the second option is Coalitions Directory, and then this will take you to the websites for the coalitions, and then let's see, I'll just click on my home state here. For example, in Illinois, we have the regional task forces are also listed, and so that will tell you what local groups are active in your area. So check out that Coalitions Directory first. I don't know, Jen or Linda, any thoughts on that, how to get involved questions?
Jennifer, I can't think of a better answer than you just gave, Megan.
Let's see.
Yeah, and you did a great job, Megan, because we don't know where she's from. If you don't have a local coalition in your area, you could be the instigator to start one. You might start with some of your hospitals in your area and find, very often the groups will start with a group of lactation consultants, and then they reach out and you can always find passionate lactation consultants that want to help with breastfeeding, but you might try reaching out to some of your other health organizations. Maybe you have an obesity coalition, obesity prevention coalition, or you have other health-related organizations in your area, and you could start a little local group and then branch out from there.
Very good idea. Thanks, Linda. Let's see. I'm realizing we're running very short on time, so I'm just going to do one more question here, and this looks like it's related to the Kellogg grant. Will we share specific plans for engaging the database of community program successes / ideas with, like I said, we're collecting a lot of different information from folks who are interested or who have active examples of success stories or possible collaborations for that phase of the project. And yes, absolutely we will. We are, I also have to give a bit of kudos to our media and development coordinator, Cheryl, who has been working very, very hard the last couple of months on a soup to nuts overhaul of our website. I think we talked about this on the last call just a bit, but we are almost ready to launch the new pages so that there will be, according to all of the 20 actions, first there will be the catalog that we've been working on for the launch is of all of the national member organizations' activities under each of those 20 actions. And then the second layer to that will be state and community programs. That one will be a little bit further down the pike, but as I said, we'll be doing this deeper assessment of the state coalitions over the summer, and we'll be using that to inform that content for the website as well. So there'll be a lot to come. As I said, we're starting off building infrastructure, including website capacity, including staff capacity to manage all of this on a much deeper level than we've been able to in the past. So we're very excited about it and looking forward to sharing a lot of information with you. I think everyone that's on this call is probably already on our announcement listservs, but if just in case, I'm going to just show you really quickly how to find that. If you are not, on every page of our website, if you don't think that you're getting email blasts from USBC, if you didn't get that press release last week, for example, on every page of our website, you'll find this Get Involved link up here in the mauve bar, and you can click that and sign up to receive action alerts, newsletters, as well as coalition-specific news. So we encourage you to do that if you're not already on the list. So I think I'm just gonna check in. I believe CDC has a couple of quick announcements as well.
Sure. We just wanted to mainly let folks know that we finally closed out the data collection on the 2011 MPINK survey, and we have the data in hand and are churning it around. And we're very excited that the response rate this time was 83%. So we've gone up. If you're data dorky person like some of us, and you've been keeping track that we were 82% for the first two. And so we're better than the U.S. Census. So stay tuned, and hopefully we'll have some great juicy details to give you about the 2011 survey sometime soon. Thanks.
Wonderful. Thanks, Kat. And you just reminded me of one other very quick announcement that we wanted to make, and that is that the webinar today for the NICHQ recruitment phase is this afternoon at 4 o'clock Eastern Time. So we will be moving on just right now to the regional calls, and then right after that, the recruitment informational webinar is at 4 o'clock Eastern. So if you need to get to this page that I'm looking at right here, this is the page on the NICHQ website. There's actually even a quicker link if you go to nichq.org, so nicq.org/breastfeeding. And I tested this out. If you go to nichq.org/breastfeeding, it will redirect you right to that page, and then you can find the recruitment information if you have not already signed up for that webinar. So we encourage folks to participate in that if you have that time free this afternoon. And we will now close it out and turn it over to our regional calls. So if you are moving on to participate in the regional call, you will need to hang up from this line and dial into the regional number that you received from your state's proctor. So thank you so much, everyone, and we will, as always, post the audio recording of this both in the archives as well as on the regional rep nominations page for folks who may be interested in nominating themselves in your regions but were not able to participate today. So we'll post that up there as soon as we can. Thank you so much. Have a good afternoon.